When we speak of the spine, really have to think about scoliosis. About 2% of the population has scoliosis, so it's pretty widespread. And the most common cause of scoliosis is what we call idiopathic scoliosis. Very rarely is it a hemivertebra, but you can see where a hemivertebra might do that. Typically the vertebrae are stacked on top of each other, but if you have a hemivertebra, it creates a somewhat different angle, and then the other vertebra line up above or below it, and it causes that curvature. So every once in a while you will see a hemivertebra causing scoliosis. It's more common in females, and it's usually picked up just on regular screening exams. So part of your exam as a regular routine health supervision visit is checking for scoliosis. A lot of schools do this on a routine basis also. You need to remember the Adams test. Usually around 11 or 12 years of age is when you're going to see this, but the Adams test can be done any time the patient is cooperative. And the Adams test is basically have the patient stand flat on their feet, out of their shoes, and they bend over like if they're going to touch their toes. And you can actually see the curvature of the spine going one way or the other. Also, just examining their backs in a standing position, you can sometimes see that one shoulder is lower than the other, one scapula is lower than the other, and you may have a pelvic tilt. Also, remember to check for leg length discrepancy, as this can cause a scoliosis type picture. You can do x-rays. The x-rays are read by the radiologist, and they'll give you degrees of curvature, and that's useful information for the orthopedist because sometimes they do need surgical intervention. Scoliosis is sometimes seen in patients that have, for example, cerebral palsy, and some muscles pull more than the others and it develops scoliosis. In those cases, you do want to at least halt progression of the curves, and they will put rods in to do that. This is a patient that is not bent over yet, and actually there's a couple of things that we can see. First of all, right here, it looks like they might have a little bit of hair. So you worry about a patient like this that might have like spina bifida occulta. Whole other chapter, we'll get to that. But if you look at the patient as she's standing, you see that this shoulder is higher than this shoulder. This scapula is a little bit more prominent than the other one, and you can actually make out a little bit of curvature there, and you can see a compensatory pelvic tilt as far as there. That is a little higher than this one, and sometimes you can even actually see that the elbows are a little bit not level with each other.